So, with the closing of my remarks, I would like to go ahead and welcome a gentleman who I've known for many years, a colleague. I first met him in internship, but we actually shared also high school. He is the current Kenya Medical Association president. He has held many other positions and posts within the Kenya Medical Association. He is a real fighter for the rights and privileges of that we enjoy as doctors. So I'd like to invite Dr. Simon Kigondu to give his remarks. Thank you very much.
Thank you very much, Dr. Karoga. Dr. Karoga Prodigy is the one who removes my earwax once in a while. I go to his place. He has some, at our home there are some advanced machines that removes earwax. Good morning, esteemed colleagues and professionals in the health sector. It's an honor for me to address you today as we gather to discuss a monumental shift in healthcare system, which is the social health insurance and related legislation. Mtu wa computer, weka ile kitu, wacha hizo story. The Act marks a transformative step in our commitment as Kenya to universal health coverage, aligning with Article 43(1)(a) of our Constitution, which guarantees every Kenyan the right to the highest attainable standard of health. The Social Health Insurance Act was enacted on October 19, 2023. Its aim was to establish a comprehensive framework for the management of social health insurance in Kenya. It sought to enhance health outcomes and provide financial protection in line with the Constitution of the right to health in Kenya. So what are the key components of the Act? It is structured in several critical parts, each part focusing on different aspects of the healthcare system. The first one is the establishment of the Social Health Authority, which is a body endowed with the responsibility of overseeing the implementation and management of social health insurance. This authority is tasked with registering beneficiaries, managing 3 funds, and paneling, very important for you people, better know that this is the body and paneling, and contracting healthcare providers, and ensuring an efficient delivery of health services. The 3 funds are critical in the pooling of resources to provide financial protection and access to essential health services. So the Social Health Authority replaces the National Health Insurance Fund. The Primary Healthcare Fund, the Social Health Insurance Fund, and the Emergency, Chronic, and Critical Illness Funds are the 3 funds that will be managed by the Social Health Authority. The Primary Healthcare Fund and the Emergency, Chronic, and Critical Illness Fund are tax funded, meaning that the money into these 2 acts will come from the exchequer. The Social Health Insurance Fund is a core of this act, and it lies in the establishment of Social Health Fund, which pools resources and risks of guarantee to access healthcare fund. This particular fund will be financed by contributions from various stakeholders, including you. You've heard of the famous 2.75% of your gross earnings. It's important to note it's gross earnings. It's not salary, it's gross earnings. So any money you make might be charged 2.75%. The Primary Healthcare Fund is dedicated to providing essential services at the primary level, ensuring that the basic healthcare is accessible to all Kenyans. The fund's resources will be utilized to support healthcare facilities and programs that focus on preventive and primary care. The Primary Healthcare Fund focuses on level 2 and 3 services, 1, 2, 3, and ensuring the basic health needs are met at a community level. The Emergency, Chronic and Critical Fund recognizes the burden of chronic and critical illness, and the Act establishes a fund that addresses this condition. It ensures that individuals facing severe health challenges receive necessary medical attention without enduring financial hardship. This means that when your monies of the social health SHIF, Social Health Insurance Fund, get finished, then the Emergency and Chronic Fund checks in. This ensures continuity. If we use a case of cancer of the larynx, previously, when your NHIF funds get finished, you stop your chemo and wait for the next year to when the funds now become active again for you to continue. The aim of this particular fund is to ensure continuity, because you have exhausted your funds in SHIF. Then now the government funded comes in so that there is continuity of care, as opposed to, so that's one of the benefits. Previously, facilities, and I know some of you have facilities, were refusing to take emergency patients because you do not know who will pay for that. So the advantage of this fund is now, if you treat a Kenyan as an emergency, then you claim into this fund. So that the one of stabilize, refer to Kenyatta may stop. Okay. Then what are the benefits and the impact of this act? It is poised to bring numerous benefits, as I said. The first one is to enhance access and equity. One of the act's pivotal goals is to enhance the pooling of resources based on solidarity, equity, and efficiency. This ensures that all Kenyans, regardless of their socio-economic status, can access quality health services. The Act introduces a means testing instrument, which is meant to identify indigent individuals who require financial assistance to meet their healthcare needs. A lot of counties have already been using means testing to identify. A good example is Kisumu, and Dr. Ganda, the CEC of Kisumu, told me they have actually used, that's what they used to identify. But now it is to be employed to the whole country to identify not only indigents, but to identify rich people who have not been paying tax, and therefore they qualify you. So if they come to your place and identify them, they think you are worth 500,000 in terms of income, then 2.75% of the social health insurance applies to you. So that's means testing. There was an advert the other day of supplier of a means testing. I hope you applied for to do means testing. Financial protection. The establishment of the funds under the Act will protect individuals from financial strain of medical expenses, reducing out-of-pocket spending and promoting financial sustainability. Improved health outcomes. So the government is focusing on preventive and primary care, as well as timely intervention of critical illness, and this act aims at improving overall health outcomes and quality of life. Previously, a lot of primary health care was not paid for, and also when you get a critical illness, you needed to have a lot of around it. So if someone is not treated during the critical illness, then their health outcomes is worse. So if you have a fund that can cater for timely intervention, it's a good thing. The Act outlines clear benefits and tariffs. It ensures that the healthcare providers are adequately compensated for their services. That is debatable, but while maintaining affordability to the beneficiary. This structured approach aims at fostering a sustainable healthcare system where both patients and providers are supported. So currently, the Ministry of Health is writing the list to say how much will they pay for laryngotomy, how much will they pay for all the services. So So that is coming out. That is called a tariff. Yeah. So, and then you'll be told what the benefit of that is. That's where the association needs to come in and push the Ministry of Health to include more benefits for the ENT community. In the modern era, digitization of healthcare processes is imperative. The Act mandates integration of the digital systems to enhance efficiency and reliability for the healthcare service delivery. They will streamline registration, claims management, administration, and making healthcare more accessible to all. I had a discussion over breakfast about dispute resolution of NHIF. If NHIF owe you money, the problem is that you have no one to report them to. That's true. I mean, they still owe us money. Recognizing the potential of conflicts and grievances, the Act establishes a dispute resolution tribunal. This body will ensure that any disputes arising from implementation of the Act are addressed promptly and fairly, and thereby maintaining trust and accountability. We hope that the complaints of payment on time will now disappear with this body. To operationalize the Act, then regulations were created by the Ministry of Health. And these regulations had key elements which emphasized on how they impact on the daily practice and broader healthcare. So the primary objectives of these regulations, so first you have an Act. You have an Act of Parliament, which you all public participation in. After the Act, then they say, how do we operationalize this Act? How do we operationalize the funds that are going to be managed by SHA, for instance? The objectives under SHA are to streamline implementation of the health funds, ensure equitable access to health services, and maintain the highest standards of healthcare delivery. The regulations were aimed at inclusive health insurance framework that covers primary healthcare, emergency, chronic and critical illnesses, and much more. They are guided by principles of equity, transparency, and accountability. The principles are designed to foster the healthcare system to start so that it's accessible and sustainable. So the primary healthcare fund is in the regulations and you need to read these regulations so that you know the nitty-gritties of it. If you don't have the regulations there, you Google, you'll get the Social Health Authority regulations. So part 2 shows how the regulations of the primary healthcare fund will be to support primary healthcare levels. Payments out of this fund are carefully managed to ensure primary healthcare facilities receive timely reimbursements. Part 3 of the part 3 of it outline the implementation of the fund, the Social Health Insurance Fund, which is the contributory fund, which is designed to pool contributions from all members. They stipulate the processes of registration, contributions, and management. Of note is that everyone will be registered anew. Whether you are in NHIF, whether you are birth certificate, they will. It will be good to see how they'll do that. They had said they will do that by March, it moved to June, I'm sure it will move to December. Part 4 is what specifies what will be done in the Emergency and Chronic Illness Fund to ensure that patients receive necessary care during emergencies, and the transition from SHA, Social Health Insurance Fund, to this fund needs to be seamless. As we have said, when your SHIF funds get exhausted, you need to be moved to now use the Emergency, Chronic and Critical Illness Fund. Empanelment and contracting is in part 4 of the regulations. It addresses how you get empaneled. They provide a clear framework for selection and onboarding of providers, ensuring that they meet quality standards that are capable of delivering required services. Contract termination and protocols and obligations for quality assurance are also outlined in these guidelines. Initially, they will not be empaneling individuals, but with the time, you as an individual will be empaneled by the Social Health Authority. So it is important to know what you need to have for you to be empaneled. And so so that you can be able to benefit from these funds. The part 6 details the benefit packages which are available under the different funds. Benefit packages means that if you come to a level 2 facilities, what will they do for you and what will be paid for by the fund? That's the benefit package. So that aligns. It's essential that as healthcare providers, we are familiar with these packages to guide our patients effectively. The benefits package and tariffs advisory panel plays a crucial role in designing and reviewing these packages to ensure that they meet the evolving needs of our population. I looked at the panel, there were no professional associations, but it requires a bit. But it is our role to input into this panel. Claims settlement. Efficient claim settlements is critical to sustainability of the social health insurance. Part 8 outlines the claims processes, emphasizes the need for timely, accurate submission. Regulations aim at minimizing delay in payments. We have experience with insurances and with NHIF, so we know how important this section is. There are also general provisions of transition. You hear they are moving from NHIF to SHA. So anything NHIF, just call it SHA. Even the workers, they are now Social Health Authority employees, but for them, they have to apply again, you know. So that's the transition clauses that they have. In the same act, there was the Digital Health Act. This is the Digital Health Act number 15 of 2023, which aims to revolutionize our healthcare delivery by integrating digital technologies into every facet of the healthcare system. The primary objectives are to promote innovation, ensure security and privacy of health data, and to enhance the quality and accessibility of healthcare services through digital means. The key objectives of the Act, Digital Health Act, are establishment of a digital health agency. There's only one doctor in the digital health agency. Who knows the doctor in DHA? ENT. Just continue removing words while the laws are being changed. It's Dr. Ganda. Dr. Ganda is the CC of Kisumu. He was appointed as one of the digital health agencies. I tried to sneak in Kenya Medical Association when we were giving feedback. You know, we are doing proposed memoranda to Parliament. I tried to sneak in DHA, a member appointed by Kenya Medical Association. They told me to stop being greedy. A member of the Kenya Medical Association is actually one of the board members of the Social Health Authority, SHA. Yeah. But we haven't been appointed yet, kuna siasa. But there is no problem. And number 2, the Act does comprehensive integrated health information system, which is a pivotal element of this Act. It aims to consolidate health data from various sources, ensuring healthcare providers have access to accurate and timely information. In the future, your patient can move the data from your office through the health system to the next doctor. So they say the patient can give permission to the next doctor, wherever it is, public, private, for that information. So we must look for a way of integrating our systems to be able to be compatible with the Digital Health Act and this overall framework that they're doing. It promotes innovation, technology, and use, and it has established a regulatory framework for e-health ecosystem to support the digital health ecosystem. There's a robust regulatory framework. So the Digital Health Agency's role is to develop and implement policies that guide the use of digital technologies in healthcare, ensuring alignment with national health objectives, ensure data security and privacy, and promoting research and innovation. When I was suing Kenya Revenue Authority for eTIMS, where you needed to put some patient data in, we used the Data Protection Act. We actually went to court and did that. And KRA actually realized, by the way, these guys have a point. So in Finance Act 2024, they have actually put a clause where they want to go around the Data Protection Act so that they can go around and they don't need data protection to come and look at your account. So the case was pretty good. I think Kenya ENT contributed to the case against it. But you see, government is working overtime, you know, to ensure that they go around their own laws to get money from you. But as I spoke to the people of the Digital Health Act, they said no, e-teams must comply with Digital Health Act. So they were telling me we should have sued KRA using Digital Health Act. So that's something to think about. So that's the role of Digital Health Agency. What is the other thing? System interoperability. As we know, we have a lot of e-systems which don't speak to each other. One of the roles of the DHA is to ensure that systems can speak to each other, including the systems in your offices. Confidentiality and privacy, this is what I was talking about. We should have sued KRA on that one, using this. One. Data classification governance, consent and data processing and data breach protocols. That's the role of the DHA. E-health service delivery, telemedicine, M-health, e-learning of healthcare professionals. So all these will be under the Digital Act. I'm moving quickly because of time. The other act that was passed was the Facility Improvement Financing Act 2023, FIF. Long time ago, before devolution, hospitals used to collect their own money, budget for their own money, and use their own money. When devolution came, the governors saw that the hospitals have a lot of money. So all the money is collected in the various hospitals, go to the governors first, then he decides whether to give you back any money. No, it's a trickle-down effect. And that brought a lot of issues with running of health facilities. So at national level, an FIF Act was passed 2023, which now allows all institutions wherever you work to collect their own money, put it in the bank account, then budget for it like in the good old days. And those days, that led to a lot of good developments of hospitals. When you have autonomy in your facility with your own money, then you can make better decisions. So that when the money is collected after treating 100 malaria patients, it's not used to make a road. It goes back and buys a anti-malarials. So this FIF Act is a good one. I have not seen the regulations. So they probably need to do the regulations. But I think there are a few facilities which had already been using FIF, like Nakuru. I think Nakuru County, there are only 4 who are using FIF, and they had various many improvements. So FIF Act 2023 is the other act that was passed together with Social Health Authority. So what is the role of health providers? The first one is to provide quality care. You have to ensure that services you offer meet the highest standards of quality and patient satisfaction. The second one is empanelment and contracting. You need to participate actively in empanelment process and ensure that your facilities are part of the network providing insured services under the Act. It's not business as usual. So, it's not automatic. You need to work towards empanelment. So it's important to learn what needs to be done. You need to do patient education and advocacy. Educate your patients about their rights, benefits under the Act, and guide them on how to access these services. Collaboration and feedback. You need to work closely with Social Health Authority, providing feedback and insights that can help refine and improve implementations. On the regulations of SHA, your role is to accurate registration, maintaining up-to-date records and ensuring that claims are processed efficiently, the timely submission of claims and adherence to prescribed tariffs. These are crucial, you see, so that you are not knocked out on technicalities and you get paid for that. So, The Social Health Act 2023 is a transformative piece of legislation that promises to reshape our healthcare landscape for the better. The regulations for the Social Health Insurance Act provide a robust framework for delivering equitable, high-quality healthcare services for all Kenyans. As doctors, your commitment to understanding and implementing these regulations is crucial. The Digital Health Act heralds a new era in our healthcare system. As doctors, we are entrusted with the responsibility to lead this change, ensuring that our patients benefit from the advancements of digital health. Let us embrace this opportunity to innovate, collaborate, and elevate the standards of healthcare in our country. Some of the opportunities that are provided by these acts include the younger doctors especially should open small primary healthcare clinics in the outskirts, kama huku NYAHUR, and make yourselves known to the community health promoters for referral. They have structured the system such that the demand is brought by the CHPs. Yeah. And it is structured such that you cannot go to Kenyatta. You must go to a level 2, 3 facility before you go to a level 4, 5 facility. So that's very, very critical. It's important to understand the primary healthcare networks so that you are in it, you enter. So for ENT is also difficult because ENT is highly specialized. So you would want to see how do you link with level 2 and 3 facilities, because earwax will be treated at 2. Now I can't go to a home. I have to go to level 2, 3. So are you the owner of that level 2, 3 facilities? Because you cannot. They cannot send you to level. You get. These are some of the things you need to think about, especially as an ENT. Is there primary health in ears? You know,
yeah, clinical officers.
Yes,
the clinical officers.
Yeah.
The clinical officers.
No. Okay, so this talk is important. Well, 2, you need to negotiate with level 4 facilities. You need to start thinking like a businessman about 4 facilities, which are the hubs. The system has been in a hub and spoke. So the hubs for contracts to run clinics and elective surgery lists at a negotiated fee. You see these monies that are coming for, you go and negotiate to run ENT clinics. There is, of course, the traditional employee, but you can actually negotiate. This is a gap. Then there are digital kiosks. You can get a system for doctors to consult from home. Consultations, you can start getting paid by consulting from home. I know some people who are already doing that, and there are regulations for that. So start earning while computer, finger computer. You get what I mean? Start earning with. So these are the gaps that these acts allow. So let us embrace this new era of social health insurance with optimism. Napenda kupigana, doctors like fighting all the time. Together, we can create a healthcare system that is not only more efficient and effective, but also inclusive and accessible to all Kenyans. Thank you very much. One more thing. The Act establishes a quality of care authority. A quality of care authority may, we need to watch out for that, may replace KMPDC, Kenya Medical Practitioners and Dentists Council, for accreditation and supervision of facilities. Okay. KMPDC may be left with licensing and monitoring individual practitioners, and the quality of care authority will be the one that will be accrediting facilities. So it's important to watch that space and see how it turns around, because it will affect the practice of medicine. Thank you very much, and thank you for inviting me to make this presentation.